Great. Well, thank you very much, everyone. I'd like to welcome you all to day 2 of our conference on youth mental health and COVID-19. What do we know and what should we do? It's great to see so many people joining as yesterday. And my name is Craig Morgan. I'm Professor of Social Epidemiology at King's College London and co-director of the recently established ESRC Centre for Society and Mental Health, which is co-sponsoring this conference along with the UKRI Emerging Minds Network and the Policy Institute at King's College. Yesterday, we focused on overall trends in mental health amongst young people in the context of COVID-19. Today, the focus will be on impacts, variations in impacts by social group. And we're going to ask the question, what is the evidence on the differential impacts of COVID-19 and related responses on the mental health of young people in disadvantaged, marginalised and vulnerable groups? And I just want to begin with a brief outline and some housekeeping. We have 6 10-minute presentations from speakers and a panel discussion with young people at the end, which will be about 20-25 minutes. Unfortunately, Nikki Chapman, who had planned to provide a parent's perspective, can't be with us. But this does mean that we'll have a little bit more time at the end for the panel discussions. And as I mentioned, as some of you are coming in, it's nice and helpful if audience members could post in the chat and introduce themselves. Throughout the afternoon, the mental health will be live tweeting. Audience members, if tweeting, please use the hashtag YouthMHCovid. We'll post in a tweet in the Zoom chat. I think Andre might be doing that now, or we'll do that soon, that people can share on their social media if they want to. At the end of the talks, as I've mentioned, we'll have a panel with pre-submitted questions that may also be scoped, given that we've got a little extra time to pick up on some of the questions that come up during the presentations. But if audience members would like to ask a specific question for clarification on the talks, then please use the Q&A feature. And after the talks, the speakers will answer where they can. And speakers, I'm hoping, will be happy to be contacted by audience members after the conference if they don't have time to answer the questions that are raised. And I'd like to ask them if they could to please put their contact details into the chat following their presentation so that it's possible for people to get in contact if they want to. We're also joined by Tim Toon and Sel, young artists from Fully Focused Productions, who are joining us to create some illustrations of the key themes from the presentations and panel discussions, which is fantastic to have and which we'll make available afterwards. The conference is also being live streamed on the Mental Health YouTube channel and will be available there after the event. The event has been extremely popular, which we're very pleased about. And we're expecting again for the the Zoom webinar to be full. If you're aware of anyone who's trying to join, you can't, then please redirect them to the Mental Health YouTube channel. I think Andre again will post or may have already posted in the chat a link to the Mental Health YouTube channel. And the conference webinar recordings will remain online there afterwards. And you'll also be able to find links to these recordings for the conference and for the presentation slides on the Emerging Minds website and the Centre for Society and Mental Health website as well. And just one final thing, we're very conscious that we're discussing potentially upsetting and distressing topics, and each day we have someone online who is available to be contacted. And today, if anyone feels upset or unsafe during the webinar or the discussions, then and you would like to talk to someone confidentially, then please send a private message to Kathy in the chat. And I think Kathy is now posting in the chat a message so that you can see Kathy and you can link if that would be helpful. Okay, and so with that, let's move on to our first talk. Dr. Charlotte Gay Anderson from King's College London is joining us to talk about the impacts of the pandemic, associated restrictions on the mental health of children and adolescents from marginalised and vulnerable groups in the UK. Charlotte's a postdoctoral research fellow at King's, focusing on understanding the role of the social environment and adversities as predictors for the development of mental health problems, in particular psychosis in adolescents. And so with that, Charlotte, I'll pass over to you.
Great, thanks very much, Craig. I'm going to jump straight in because there's a lot to cover. So we know that the pandemic has subjected children and young people to a variety of known risk factors for mental health difficulties, and it's very conceivable that young people from vulnerable or marginalised groups may be feeling the impact of the pandemic much worse, with consequent negative impacts on their mental health. And in the next 10 minutes, I'm going to try and give an overview of what the UK research tells us, firstly, on whether young people from marginalised and vulnerable groups report greater mental health difficulties during the pandemic. This mostly comes from cross-sectional data so far, and is of course useful for us to know who at any point in time is struggling more. But given that we know that individuals from these groups experienced greater mental health difficulties even before the pandemic, this cross-sectional data doesn't really tell us if those from vulnerable or marginalised groups are disproportionately affected by the pandemic. So I'll also present what longitudinal data there is so far of studies pre to post pandemic or at multiple times across the pandemic, to discern whether there's any evidence of differences in the trajectories of mental health problems across groups. In other words, is there any evidence that some groups may be experiencing a worsening of mental health as a result of the pandemic? So firstly, pre-pandemic, individuals from Black, Asian and minority ethnic groups generally in the UK were more likely to experience mental health difficulties and have more problems accessing care. And of course, it's been suggested that these mental health inequalities may have further increased during the pandemic. And when we look at cross-sectional data that's been made accessible so far, findings are quite mixed. One study suggests that young people from minority ethnic groups have better mental health compared with their white peers. A few studies suggest worse outcomes in Black and Asian and minority ethnic groups. But I think the weight of the evidence suggests, at least cross-sectionally during the pandemic, no differences in mental health difficulties in young people across ethnic groups on a variety of outcomes. And just to add, the references that you can see in the bubbles here in the last two slides of this presentation is a list of the references of the papers that I'll be referring to. So if you want to refer back to any of these, you can access that in the last two slides of this presentation. And similarly for longitudinal studies which have measured mental health over time at multiple time points, either pre to post pandemic or during the pandemic, studies have not really shown any differences in the trajectories of mental health difficulties across ethnic groups. I think one caveat of this is that, unfortunately, due to the lower representation and small sample sizes of minority ethnic groups in many of the surveys, individuals from different ethnic groups are combined into one group generally, therefore potentially sort of masking differences between them. So turning now to young people in socioeconomically deprived families, we know sadly the pandemic has resulted in vulnerable socioeconomic groups experiencing far greater financial pressures, greater health risks, having to live in worse housing conditions, and particularly for children in poorer families, difficulties in receiving the same level of education due in part to the digital divide. Cross-sectionally, what we see in research, a few studies have found no differences in mental health in young people from more deprived backgrounds compared to those from less deprived backgrounds, but perhaps there's more evidence to suggest that those from poorer families have worse mental health outcomes. Looking at the trends over time and the longitudinal data, quite conflicting findings are found. So for example, in the study in the southwest of England by Widnall and colleagues, they found no differences in trajectories pre to post lockdown between those from more deprived compared with those from less deprived families. Whereas data from the Wirral Child Health and Development Birth Cohort Study found in actual fact greater increases in depression among children from higher income families pre to post lockdown. Pre-pandemic, children with special educational needs and difficulties report increased mental health difficulties compared with their peers without special educational needs and difficulties. And with school closures, this group may be disproportionately impacted due to changes in their routine and not being able to access the same levels of support. And in line with this, the cross-sectional data would suggest that children indeed with special educational needs and difficulties do have elevated levels of emotional and behavioral difficulties and lower well-being, lower life satisfaction and lower happiness during the pandemic. But again, however, when looking at trends over time, some conflicting results are apparent, with a couple of studies suggesting more negative trajectories in children with special educational needs. Whereas in contrast, one study, the co-space study, at least over the first 4 months of the pandemic, showed greater decreases in emotional problems among children with special educational needs. And finally, it's been suggested that children and young people with a history of mental health difficulties prior to the pandemic would fare worse in terms of their mental health during the pandemic. And studies have consistently shown that individuals with a prior history do indeed have higher rates of a variety of mental health outcomes during the pandemic compared with those without a prior history. Again, though, to consider the question of whether those with previous mental health difficulties are sort of disproportionately impacted, this is less clear. And in 2 longitudinal studies that's available so far, data has shown a greater increase in emotional and or behavioral difficulties among children without a prior history of mental health difficulties. So I think this has all been a very, very quick, broad brush kind of presentation of the main findings to date. And I think it's really important to note that these studies have looked at a range of different outcomes using very different measures, and has looked at very different developmental periods as well. Some studies have used self-report data from the children themselves. Others have relied on parent reports of mental health outcomes. And many studies have relied on a self-selecting and possibly quite biased sample of individuals, all in all making kind of the inferences and comparisons really quite difficult to make. But generally, I guess the overall message is that it would appear that at least during the pandemic, a greater proportion of individuals who either have a previous history of mental health difficulties, those with special educational needs and difficulties, and those from low-income families are experiencing higher levels of distress. But as I mentioned in the first slide, it's important to note that this sort of mirrors what we were finding prior to the pandemic. And with the few longitudinal studies that have been published or made available to date, there's just sort of too few to make any kind of meaningful or firm conclusions on whether individuals in some vulnerable or marginalized groups have been disproportionately impacted by the pandemic. And of course, unfortunately, data is even more scarce on other populations of vulnerable children or young people, those who identify as LGBTQ, those who are migrants or refugees, or those living in insecure children's homes. And one final thing to note, sorry, I guess that sort of something, what this broadly reflects is experiences of children and young people a year ago, so in the very first lockdown. And based on the qualitative reports and focus groups that we've carried out as part of the REACH study, which you'll hear about later today, we have reason to believe that with the ongoing restrictions and continued uncertainty surrounding COVID and the last-minute changes to educational policies and examinations, the mental health status of children and young people, and perhaps more so in vulnerable and marginalized groups in particular, may paint a very different picture from what has so far been found in the first lockdown. And that's it. I'd just like to say thank you. As I say in the final 2 slides are some of the references that of the papers that I've referred to, and thank you very much for listening.
Wonderful. Thanks very much, Charlotte. A very useful overview of what we currently know. And I think a lot of themes that we will pick up in the remaining talks about the varying patterns. And I think the remaining talks will give us some more detail in relation to particular groups. So with that, I'd like then to move on to our next talk. Dr. Katie Pybus from the COVID Realities Project at the University of York will be talking about the experiences of families living on low income during the pandemic. Katie started her career as a mental health nurse, working in both hospital and community settings in London and Yorkshire. She completed a PhD at the University of York and now works there as a research fellow. Katie.
Thanks very much, and thanks very much for sort of having me along. So, yes, I'm here today. I'm going to talk about the COVID Realities research project, and I'll tell you a little bit more about that and sort of some of the themes that are coming out of that in terms of kind of the mental health of young people and children, and also sort of families more broadly, parents and carers. It's worth saying that the project's ongoing and that, you know, we're seeing lots of kind of contributions that relate to mental health. So I'm going to kind of do a bit of a broad brush on some, you know, themes today, but please do get in touch, you know, because there's a lot more kind of, you know, information that we have about this part of the project. So, okay. So what is COVID Realities? So it's an 18-month sort of research program. We're looking at the experiences of families living on a low income during the pandemic, and we're also looking at the sort of social security response as well. So we're working in partnership with parents and carers really to you know, document people's experiences, and also to sort of develop recommendations for change as well, and what's working and what isn't for families living on a low income. So our participants, so we've got a website which I'll show you sort of at the end of the presentation as well, so you can kind of see the interface. But what we're doing is kind of people sort of are uploading diaries, diary entries onto the website all the time. We have sort of a big question of the week, so we, you know, different kind of topics, and we have different sort of contributors who sort of ask questions, and people can kind of respond to that. We're also running sort of monthly focus groups, and we've just started doing some work to enable people to work on some arts-based things as well, like audios and zines as well. And in addition to that, we're also engaging with other researchers and with policymakers. So just to kind of put it into perspective, we had if we just sort of take the last month, then we had about around about 300 sort of diary posts. So we, you know, that's kind of the scale. And we have some people who contribute often, or some people only contribute once or twice, and you know, it's really up to people how much they want to get involved. Our contributors are sort of predominantly female. We've got sort of a larger number of single parents. It includes people who are in and out of work, people who have sort of ended up you know, on a low income or pushed into poverty by the pandemic, and people who were sort of living on a low income before that as well. So, okay, so I'll just talk through some of the themes that are sort of emerging for us. So the first thing it's really worth mentioning is that you know, life on a low income was already sort of difficult before COVID-19. And you know, that's been sort of exacerbated by the pandemic for sort of a, you know, good number of families that we've spoken to, and some of the reason for that is around you know, some of the usual sort of strategies for managing on a low income are not necessarily available to people at the moment. So that might be about you know, seeking kind of support from family, you know, things like charity shops are not open, access to food, kind of shopping around to buy kind of discounted goods, that type of thing. Those things haven't been available to people. At the same time as that, costs have risen for a lot of families. So from spending much more time at home, from you know, needing things like connectivity, the internet, that type of thing to enable homeschooling, those types of things. So all of those kind of worries and stresses and anxieties around sort of, you know, struggling to make ends meet that are there kind of you know, were there pre-pandemic have sort of been exacerbated. So the impact on that has obviously been kind of more stress for families. So in turn, you know, what we can see, and you know, these are kind of quotes from some of our contributors. So you know, the mental health of sort of parents and carers really during the pandemic, we're really kind of seeing that those impacts of sort of you know, struggling sort of financially, but also you know, trying to support children and young people who don't have access, you know, to the same kind of educational opportunities, who have seen this kind of prolonged reduction in social contact. You know, parents kind of worrying about what that means for children, and children sort of also you know, being concerned about the pandemic, about sort of not seeing friends, that type of thing. So it has been quite you know, really difficult for people. I think though, just on the last quote, it's sort of worth drawing your attention to what Melissa's saying here, which is around the fact that things have been difficult, but there's also been some really lovely times sort of with children as well. So being able to kind of get out and about, being able to spend more time together. So that's certainly been something that our participants have spoken about as well, that extra kind of family time. But all in all, you know, it has been quite difficult for people. Okay, and yeah, so the other thing is, so because we've been sort of you know, working with families since sort of last June time, we can see kind of sort of differences in people's experiences over time. So this obviously is a work in progress, and we're still you know, we're still sort of recruiting, and we've still got people contributing. But you know, I think it's worth sort of mentioning, you know, what you can see kind of initially as some kind of sort of acute anxieties associated with that adjustment and moving into lockdown and all of those kind of you know, difficulties. As things go on over time, we've had a few sort of lockdowns now. You know, I think it's more this sense of kind of you know, being kind of ground down over time, really. And you know, it's these worries about kind of child development, really, and this prolonged sort of lack of social contact and educational inequalities, and you know, and those issues and those difficulties that were there to begin with obviously haven't necessarily gone away, and things might not have got easier financially for people and things like that. But I think you can kind of see over time that it's sort of a real kind of endurance test at this point, I think, for people. So okay, and then yeah, and I just wanted to sort of you know, highlight that, you know, a few of our parents and carers have children who have sort of you know, different needs, might have had sort of pre-existing you know, mental health conditions and physical health conditions sort of prior to the pandemic. And you know, I think what sort of happened during this time is that, you know, some of that support that might have been available, some of those support mechanisms that were in place are not necessarily, or you know, they're as much, or they might be sort of in a different form. You know, and also that kind of you know, disruption to routines, really, you know, going shopping, and that experience being kind of very different and quite sort of you know, people wearing masks all the time. All of these things kind of are having an impact on people. So as we can kind of see from some of the quotes here. So you know, Alex here is speaking about her child who's on the autism spectrum, and who prior to the pandemic had sort of private tutors and could have a quiet, you know, corner of the library to sort of to do schoolwork, and you know, has not kind of got access to that now, and therefore is you know, not able to kind of be educated, which obviously is really kind of difficult. Okay, so just sort of looking ahead, I guess, you know, certainly I know it's kind of different around different parts of the UK, but you know, in England we're sort of thinking about children going back to school next week, and you know, thought it was worth highlighting, and it would be really interesting just to kind of see what people's thoughts are on this, you know, perhaps in the discussion later. But you know, we're sort of having this debate at the moment about how we do sort of support children's mental health going forward as we kind of move on from the pandemic, and well, not move on from it, but, you know, start to move forward, and some of the restrictions are lifted, and whether that's about, you know, more school time for children, or whether it's actually that children need that summer to kind of play and see their friends and have that sort of social contact that's really been missing over the past year. So I'm just sort of conscious of time, so I'm just going to kind of finish off by sort of talking about you know, a few of the things that we're thinking about at COVID realities going forward. So obviously there's lots of sort of different interventions that you know, we might think about to sort of support families that are living on a low income, you know, as we move forward. But I've chosen here just to focus on social security, because we've got the budget coming up tomorrow, and it is an area of importance, sort of certainly to our participants. But you know, certainly families have told us that retaining the universal credit uplift is going to be really key. You know, it's worth noting that that's not really being experienced as extra money for people, you know, in terms of being able to spend it on things that aren't necessities. It's just kind of helps people to get by. Extending that uplift and then addressing some of the kind of other excuse me, areas of social policy social security that are impacting on families. So people having kind of deductions taken out of the benefits, being affected by the benefit cap, you know, all of these things kind of make for sort of a weaker financial safety net for people. And you know, I think ultimately, if we're going to think about sort of you know, improving people's incomes and the associated impact the positive impacts that has on mental health that we know from the evidence base, then, you know, social security is one area we need to think about. And certainly at COVID Realities, this is something that we're going to be working on with our families over the next few months, is to sort of think about a longer term vision for the social security system and what that would look like. Okay, so I'll just finish by sort of, so I said I would show you sort of a little bit about the interface for the website. So we are still recruiting if any parents or carers want to get involved in the project, and you can find out more by visiting the website. You know, we've also got on there sort of write-ups, so we've got briefings and learnings that we've taken from the project so far, as well as a live archive of you know, people's experiences that they've posted up there, so you can kind of see that in a bit more real time. And yeah, and just to say, you know, people, this quote here from Victoria B, one of our participants, you know, just that people have kind of seem to have really valued being involved with this and being able to kind of communicate their experiences, being able to sort of meet up with other people in the same position. So in that way, it's been kind of, you know, really valuable for people that have been involved. So I will end there, just bearing in mind time. So thank you very much. I'll put my email details in the chat as well, but if you want to get in touch if you've got any more questions, then I'll be more than happy to answer them. So thank you.
Thanks very much, Katie. It's really, really good to consider and to learn from the insights from listening to the voices of people who are struggling and experiencing these kinds of challenges. And particularly important to think about what could be put in place. That's something that we'll also pick up tomorrow in tomorrow's session, of what it is that we can do to support young people and families and parents through these very challenging times. If I could then move on to our next talk, Dr. Gemma Knowles from the REACH project at King's College London is presenting on COVID-19, social restrictions and mental distress amongst young people from diverse backgrounds. Gemma is a postdoctoral research associate with us at the Centre for Society and Mental Health at King's, and over the past 5 years or so has led the REACH project. So Gemma.
Thanks very much, Craig. All right, is my screen okay, Craig? It's changed format on my screen, so just to check.
All good, it looks good.
Great,
now.
Lovely. All right, great. Okay, cool. So I'm just going to say a bit about the research that we've been doing about the impacts of the pandemic on the mental health and experiences of young people from diverse backgrounds in inner city London. I've got quite a lot to cover, so I'm going to go relatively quickly, but if anyone's got any particular questions about REACH and the background to it, then do pop them in the chat and we'll get back to you on it. So basically for the last 5 years or so, we've been running a cohort study of adolescent mental health in Lambeth and Southwark, which are two socially and ethnically diverse boroughs in inner city London. A cohort study, it just means that we're basically working with a large group of young people and we're following them over time to understand which factors influence their risk of developing a mental health problem, and importantly, which factors are protective for young people's mental health as they get older. And so before the pandemic hit, we'd already collected quite detailed information at 3 time points in the 3 years immediately preceding the pandemic about young people's mental health and about their social circumstances and experiences. And we usually, we're a school-based study, so we usually work in secondary schools, and the photo at the bottom there, we go into classrooms and ask young people to complete questionnaires and do interviews with us and so on. And so when the pandemic hit, we obviously had to stop that and start doing everything online. And I just wanted to say a big shout out to Anna Niakani and Taisha, who are on the call today, who are our Young Persons Advisory Group, who were absolutely instrumental in allowing us to, in kind of helping us to understand how to do this and also what kinds of data we should be collecting. So big shout out to them. So anyway, so last summer we invited the young people that are taking part in REACH and who have been taking part for the last few years to provide information about their mental health and their experiences during COVID. And that work's ongoing, but today what I'm going to do is present some data that we collected last summer between May and August, so essentially covering the kind of first lockdown and the first period of school closures and restrictions. And the 3 kind of key questions that we were asking in collecting this data are, first, whether there's any evidence that that mental health problems became more common among young people in inner city London during the early phase of the pandemic. And then second, whether there's any evidence that the impacts varied by gender, by ethnic group, or by household income. And throughout this talk, you'll hear me use free school meals as an indicator of household income. And then we were also interested to know whether any impacts on mental health varied by young people's pre-pandemic or mid-pandemic circumstances and experiences. So, for example, is there any evidence to suggest that those with pre-existing mental health problems or those with pre-existing financial problems and so on are differentially impacted by the pandemic compared with their peers? So just to say a bit about the young people that are taking part. So the full REACH cohort is highly representative of young people in Lambeth and Southwark. And as I said, it's a very diverse area. And so we have large proportions of young people who receive free school meals and large proportions of young people from Black and minority ethnic groups. And indeed, I will err away from referring to minority ethnic groups here because they're the majority in this context. And so we have data that's really local and allows us to look in more detail at whether certain groups of young people are impacted more than others. And I think we're one of few groups really, I think, that have really detailed information about these young people in the immediate run up to the pandemic. So our first question then was, is there any evidence that that mental health problems became more common during the early phase of the pandemic compared with pre-pandemic? And what you can see on this slide here is data that's it was collected using the SDQ, the Strengths and Difficulties Questionnaire, which and essentially with this, anyone who scores above a certain threshold on the SDQ is considered to be at high risk of mental health problems. And what you can see here is the proportions that were struggling with their mental health at time 1, so back in 2016-17, all the way to time 4, which was last summer. And as you can see, we found no evidence of an increase in the proportion struggling with their mental health in the early phase of the pandemic. And we also looked at this for other mental health outcomes, things that have been collected at each time point. So, for example, on self-harm, anxiety and depression, and we observed the same kind of broad pattern, that there was no notable increase in the proportion struggling with their mental health last summer compared with pre-pandemic. And we spoke with the Young Persons Advisory Group about this, and they actually were not that surprised by this overall finding, because they were all aware of people who had really struggled during the pandemic, but also people who had really enjoyed the first lockdown. And so what we generally see is a pattern of, and I think it plays out in these 2 measures that I'll show now, that while we have substantial proportions of young people reporting negative impacts and substantive worries and concerns due to COVID, particularly around grades and exams and uncertainty about their future, there are also quite, it was also quite common for young people to report the positive sides of lockdown in that early phase. So enjoying having more time to themselves, spending more time with family, feeling less social pressure and those kinds of things. And whilst there was some, and we kind of broke these numbers down by ethnic group and by household income, boys and girls, and there were a lot of similarities in the proportions that were reporting particular concerns. And the things that really stood out as differing across groups were that Black African and Black Caribbean young people were more likely to report being significantly concerned about their about markers of kind of like their future and uncertainty around that, and also around financial hardship. And it was the same pattern with those who were on free school meals compared with their peers. And then when we compared boys and girls, generally there weren't that many differences in the how common concerns and worries were among boys and girls. The main differences really were that girls were more likely to report being concerned about falling behind with schoolwork and with their exams and grades compared with boys. And so what we wanted to do then was look in more detail at whether the impacts of COVID on mental health differed by different groups of young people, and also by their pre-COVID circumstances and their kind of mid-COVID circumstances. And so the next 3 slides that I'll show you will cover those 3 things. And what you can see on these slides is this is the change, so within person change in SDQ scores, and the line down the middle is basically no change. And bars that go to the right of that line suggest an increase in their SDQ score, which indicates a worsening of mental health. And bars that go to the left are a decrease in SDQ score, which suggests an improvement in mental health. But when you look at this is broken down by ethnic group, by free school meals, and by gender. And when you look at this, actually, while it looks like on the face of it there might be a bit of variation, this variation is really quite small, and there's not really any notable evidence that that any of these groups were particularly impacted negatively in terms of their mental health in the early phase of the pandemic. So again, we looked at this by the kind of pre-COVID circumstances and experiences. So for example, whether they had a pre-existing mental health problem, whether they reported experiences of being bullied pre-COVID, whether there were financial problems at home pre-COVID, and so on. And generally the picture was, again, that there wasn't any strong evidence to suggest that the impacts of COVID were disproportionately high among any of in any of these particular groups. And so but we do know that these groups did have the mental health problems were more common among these groups before the pandemic. And so the message is, whilst there's no evidence to suggest that the impact of the pandemic, the kind of change from pre to mid-pandemic, differed by these different circumstances, it suggests that those inequalities that existed already before COVID persisted, but at least in the early phase of the pandemic did not widen. And then we look at the kind of the change in mental health scores pre to mid-pandemic by their mid-COVID circumstances. So essentially what young people are telling us happened during that initial phase of the pandemic. And this is where we start to see a bit of variation, although for many of these markers it's quite modest. But so, for example, for young people who reported changes in their family relationships due to pandemic, there's a fair amount of variation here. So those who said that their relationships with family improved a lot during the initial phase of the pandemic compared with before the pandemic, their mental health improved. And then conversely, those who reported that their relationships with family got a lot worse, their mental health declined. So perhaps a suggestion that it was the circumstances during the pandemic that was more closely related to change in mental health, but overall the kind of inequalities in mental health that we observed in this group before the pandemic generally persisted, but perhaps did not widen. And we are at the moment going back to that same group of young people to find out how things have been for them over the last 6 months. And hopefully then next time we come together, we'll be able to present data on whether things have changed over time, and certainly the reflections from the Young Persons Advisory Group suggest that maybe that will be the case. Thank you.
Thanks very much, Gemma. It's interesting to begin to see the evidence emerge in quite a nuanced and quite a mixed and varied picture that begins to emerge, at least from these kinds of data. So thank you very much for that. If we can now move on to our next talk, Laura Fischer and Jane Chevous are joining us to talk about off-radar children and young people at risk of abuse in their homes during COVID-19, asking the questions what we need to know and what can we do. Laura's an artist, a researcher, lecturer and a survivor activist who specializes in trauma, and Jane is co-founder of Survivors' Voices, an abuse survivor-led organization that provides peer support and harnessed expertise for survivors in research, education, advocacy and campaigning to improve responses to abuse and trauma. So Laura, Jane, over to you. Thank you.
Thank you very much. So, whoops, there you go. Thank you everyone for being here and for listening to our talk. So as mentioned, we're going to talk about how to support children and young people who are trapped in abusive homes during COVID-19, but also beyond. So this talk is based on the work that we've been doing since lockdown 1. We, like many other survivors, have been very concerned about the impact of the lockdown and other social distancing measures on these children and young people who are experiencing abuse at home, because many of them are not known to services, are not known to anyone really, and are experiencing violence and abuse at home and perhaps even increasing amounts of abuse. So we partnered together. We did a research project that is entirely led by survivor researchers, and we partnered with King's College, the Violence Abuse Mental Health Network, Survivors' Voices and Macfin Foundation. We ran a survey, first a rapid response one, then a fuller one, and also a series of roundtables. So today we're going to talk to you a little bit about our findings and about our reflections and our recommended actions. We have our final reports coming out next week. So what we talk about today is all in the report, and there's more there as well. So we do encourage you to keep an eye out for that. Okay, I'll pass on to you, Jane.
Thank you, Laura. And just to flag up that I'm calling on a mobile signal from Spain. So if my sound goes dodgy, Laura will pick up for me. Just some statistics about the survey. 71 people took part in the survey. The majority were adults who had lived experience of abuse, or young people with lived experience of abuse, and then also some professionals or family members or other allies of survivors. And then the 3 round tables, 37 people attended altogether. And that was a first roundtable was for survivors of abuse. The second roundtable was practitioners who from a variety of sectors, including education and psychiatry, youth work, children's services. And then the final roundtable was with communication and media experts, looking at how we get some of these messages from the research to young people. Thanks, Laura. So kind of overview of the findings, and then we'll look at a few things in a little bit more detail. It's important to recognise that if you're being abused in your family home, we shouldn't be expecting children and young people to reach out to us. We should be reaching into them, because it's incredibly hard for somebody in an abusive home to reach out for help. And the other important thing is to recognise that there are a lot of us, and this was something that, you know, why we did the research, because that was our experience. I was somebody abused at home who nobody knew about, yet their signals are there. We're hidden in plain sight, and sometimes perhaps the way that we behave as children or young people could be a clue to what's going on. So the important thing is then to say, how do we find the young people, and how do we help them? And what came out of the research was that we need a global conversation, because even though you might think that we have talked a lot more about abuse in recent times, it's still clearly not the case that everybody knows how to recognise abuse and how to respond to it, and that will be the best way to protect and help children and young people. Another big thing that came from the research was the importance of safe spaces. By that we meant internal safety for children and young people, relational safety with people that they could trust, and physical or virtual spaces where they knew it would be safe to disclose. And then for that to happen, we need to be better at listening to children and young people, and we'll say more about that as I go through the findings. And then once we are in relationship with these children and young people, we need to not take over. We need to trust that children and young people know what's best for them and what they want, and empower and support them to lead the way. And finally, survivors wanted to say very clearly that while it's a very difficult road, healing is within reach, and all of us as survivors of abuse deserve a path to healing, and it is all of our responsibility, everybody's responsibility, to try and ensure that this happens. Thanks, Laura. So we grouped the data, the findings from the survey and the focus groups on our own reflections into 4 key themes: the importance of awareness and education, the need for these safe places and relationships of trust. We looked at some of the barriers to disclosure and how we could make it easier for children and young people to signal what's happening, and the importance of children and young people being heard, in control and supported. Thanks. So I'm going to go quickly through some of the themes. I won't pick out everything. As you said, the report will be available next week. So just some highlights. On education and awareness, it kind of feels frustrating as a survivor actually to have to keep saying this, but it was very clearly the messages coming out of the research that we still need a better understanding of abuse, how to recognise it, how to have conversations about it, and then what to do about it. One of the things is about trauma, people, adults and professionals and practitioners being trauma informed and knowing to recognise some of the signs of abuse. And very important in that is recognising that if you grow up like I did in a very abusive family, and that is all you've ever known, then you don't know that that's abuse, and that's not the language that you would use around it. So we need to be having conversations with children and young people about what is safety, what is well-being, what is comfortable, and not using words that children and young people might not identify with, such as abuse and trauma. And also helping children and young people to understand that if they're experiencing violence and abuse in the home, that this isn't something that they have to accept. This is something that something should be done about. And the other thing I'll pick out is the importance of children and young people hearing about the stories of other survivors who have gone through this and come out the other end and been safe. Thanks, Ellen. Laura. And we've put quite a number of quotes in the report, and we'd ask you not to tweet these, actually, just to keep them confidential to the report. I'm just going to pick out one from each side. So one thing that would help is if all the levels there was an awareness and understanding of the large-scale nature of childhood violence and abuse, at least 1 in 4, in the home, and its immediate and lasting impacts. Thanks, Laura. So the second key theme is about safe places and trust. I've talked about the 3 types of safety. So the participants came across strongly as saying that we need to create safe spaces, both virtual and physical spaces, where children and young people can be safe away from harm, and that we need to create relational safety so that children and young people have access to trustworthy people. it's often said that survivors have problems with trust, but in fact we have problems with identifying trustworthy people. So those of us who are practitioners, perhaps we need to think about how do we become trustworthy people and how do we develop those relationships of trust with young people. During pandemic times, there's a suggestion that we should, those school teachers and others should check in regularly with children and young people to make sure that they're okay. And if children and young people do make a disclosure, to think carefully about what happens next, and I'll come back to that. So the third theme was being heard, in control and supported. And this is, I'm sure the youth panel might have youth members of the panel might have something to say about this later. Ways to ensure that young people are heard, making sure that we're being open and non-judgmental in our responses, ensuring that disclosures are believed, and seeing a young person as a whole person, not just as a victim, survivor, and very importantly, confirming that what happened to them isn't right. Thanks, Laura. Ways of ensuring that young people are in control, providing clear information on options and discussing what can happen with disclosure, and as far as possible ensuring that the children and people are in charge of making the decisions about what options are followed. This could include making plans together about safety, and making sure that they are aware of their rights, for example, under the Children's Act. Thanks, Laura. To make sure young people are supported, very strongly a theme came out about somebody being in contact with one person, a regular person that they could trust. And we know from work with the care system that this is a real problem, that children and people end up, once they're in the system, with so many different practitioners rather than one key person that helps them to navigate their way to safety. The reassurance that it's not their fault what has happened, and it's not them that are in trouble, and that there are people who care about them and can help, and practical support with information, and particularly things that help them to express their feelings and support their well-being, as well as actions that are around safety. Thanks, Laura. I think we need to skip on probably.
Yes, actually, we are rapidly running out of time. So I think we should finish the key themes and then hop to the actions. And everything is in the report anyway, so we'll just give you more incentive to look at it.
So one or two, the barriers to disclosure. Talked about not understanding that what they're experiencing isn't right. Loyalty to the family, and internalized messages of shame, and the mistrust of adults. One thing that came out with some additional research which was done with young people is that they're far more likely to disclose to their peers than to adults. And the other thing is trauma behaviour being hidden under what is seen as either a difficult child or the model child. Okay, Laura, back to you.
Okay, thank you so much, Jane, and apologies that we can't share everything that we want to share with you. But these are the key themes that, as Jane discussed, and you will find this can now act as a glimpse, as a preview of the report. So you will find in the report some practical tips on how to communicate with children and young people, on how to use social media and phone-based resources, on how schools can help because they have a key role to play, and also on the role of messages of hope and what kind of messages we can share to support children and young people. And so that leads us to reflections and the actions. So again, I'm going to skim through the reflections because this is all in the report and we won't have time to go through them now. But in short, we do not have a shared understanding of language. As Jane mentioned, we need to think about language very carefully, because if that's your norm, that's your reality, then you're not going to talk about abuse and trauma. We just wanted to question the assumption of whether children and young people wanted to be found and helped, and in short, the answer is yes. in the answer is we want abuse to stop, but we want interventions to be carefully thought through, and the current process is not always the best. Leading on to that, yes, so we essentially need to build safe places and trust, and we need to have systemic reform as well as alternative solutions, and healing is possible with the right support and resources. It's really important, and I do want to take the time to say this, it's really important to listen, give control and empower children and young people, because being abused means you have no voice, no control and no power. And we can't help children and young people by replicating that. So the only way towards safety and recovery is to really reinforce their voice, their control and their power. We talked about the barriers already, so I'm not going to go over this again. And I'm going to just share the key 3 actions, our 3 learnings, main learnings and recommendations. First, abuse is hidden. It's really difficult to recognize, but it's really important that we know how to. So therefore, our recommendations is that we need to help people recognize abuse in their own experience as well as in others. We need the language to be able to describe that. We need to train teachers, youth workers, and essentially everyone to be able to recognize abuse, to know what to do about it, to know how to handle it really well. And we need a wide global social conversation to raise awareness and understanding of abuse, to rewrite the narratives of trauma on survivors' own terms, and to know what to do and how to manage the complexities and challenges around this. As Jane said, reaching out to help is key, but we must do this sensitively. So we need safe spaces where children and young people can find refuge and be safe from harm, but we also need to build good relationships, make ourselves available so they can reach out to us and proactively reach out to them as well, so not all responsibility is placed on them. It's really hard to reach out. And we need nuanced conversations, because this is a complex topic and there's no point trying to simplify it. We need to just know how to navigate the complexities sensitively. And finally, we must act to protect children and young people from abuse, and our actions must be led by them. And I really want to stress that last part. So we need to understand that protecting children and young people is everyone's responsibility. No matter who you are and where you are, we all have to protect and do what we can to support children and young people. They deserve our help. So we therefore need to support people to know how to do this, how to notice it, how to support, and also how to not turn a blind eye. Nobody wants this to happen. Nobody wants to look at this. Nobody wants to confront this. But the reality is it's there. It's very, very common. And it's very likely everyone knows at least one person who's experienced or has experienced abuse. Therefore, we need to really there to open our eyes and to approach and recognize and help. And be better at listening at children and young people's needs and following their lead, considering options carefully, being trauma-informed and trauma-sensitive, coordinating efforts all together so it's not all disjointed efforts, invest resources appropriately, communicate hope to support children and young people, because that message is going to reach people you don't know are being abused, and that can go a long way along with interventions. We need to support them to manage it through. And recognizing the strength and wisdom of these children and young people and survivors. So I will stop here. We have actions specific to the pandemic times for different groups. And again, this will just be a tease to bring you to our report next week. And finally, just wanted to reiterate how this is a collective responsibility. Thank you all so much. There are links to everyone here. The slides will be shared, so we can also put them in the chat. A little quick shout out to Fully Focused Productions, who helped us with a related report on this. So that will also be linked. Thank you.
Wonderful. Thanks so much, Laura and Jane. And thanks, Jane, for calling in from Spain. It worked very well, actually. Thank you very much for that. Such an important topic, such a challenging topic. And Helen has put some very helpful links as well, in addition to what you've presented, into the chat. So please do follow those. We're going to now move on to our next talk, to Dr. Georgina Miguel Esponda, who's based at King's College London, is presenting on From Feeling Lost to a Better Understanding of Yourself. How did lockdown impact the mental health of young people in inner city London? Jean is a postdoctoral researcher at the Centre for Society and Mental Health. And I think we're going to get an opportunity in this to hear a little bit about and hear directly from young people. So Gina.
Thanks so much, Greg, and thanks so much everyone for listening today. I'll be presenting some of the preliminary findings of the REACH Diary study, and this is a qualitative study nested in the COVID-19 REACH project, of which Gemma told you earlier today. So first of all, I want to tell you a bit about the aims and methods of the study. This qualitative study aimed to gain an in-depth understanding of the experiences and mental health impacts of the pandemic on young people, including the impacts of lockdown and then of the return to school amongst ongoing COVID-19 restrictions. So we conducted semi-structured interviews where we explored the experiences during the first lockdown, and then we asked young people to complete weekly diary entries where they told us about their return to school. Recruitment and data collection started in September 2020 and were completed in February, so just very recently. And today you'll hear the findings about the young people's experiences during the first lockdown. I want to tell you a bit about the characteristics of the young people that took part. So we had 49 young people completing semi-structured interviews. And as you can see, we had a fairly even gender split. We recruited participants from schools in inner city London, so the backgrounds were very diverse, just as in the rest of the REACH sample. You can see that most people were not at risk of having a mental health problem. Also very important to say that participants were between 15 and 17 years old, and they were in year 11 or year 12. Well, most of them were in year 11 or year 12, which is an important thing to consider as exams are such a big concern for this age group. And then finally, about half were receiving free school meals. So as Greg mentioned, we've prepared a video to share with you the findings because we wanted you to hear from the young people that very kindly accepted to share their stories with us. So I'm just going to switch my share screen. While I do that, a big shout to Esther, my colleague who helped bring the voices of these young people to life. Sorry, just give me 1 second while I do the technology.
Okay, initially I liked the break, because it felt like a bit of a holiday.
Yeah.
Yeah, literally just a holiday, a time you could just rest and do nothing. Like, I like that. And I like the idea of having so much time on my hands, waking up, having nothing to do, you can just do anything in that time. It was just understanding that you're not in a rush. You have time on your hands now, use it to understand yourself. Wake up one morning, to focus on one area of your life.
It was like a breath of fresh air because during school, sometimes like when I had like I had drama therapy and I had a learning mentor, and in both of those like sessions, they tried to make me not plan but think about how I could achieve certain things or how I could like get my future basically. But I felt like I couldn't really think about that when I had to focus on schoolwork, or like after the session I'd go back to class. I focused on that in the session, but outside of the session I couldn't work on it. So it was like, it made me a bit happier because like it was more real, like it wasn't just an idea.
I've gotten closer to my mum and dad in a way. This lockdown now, and most recently, I've gotten more close. Like, I've learned to cherish family more, and like I've seen the importance more of family. Like my sister, like it's just recent. So I never used to speak to my sister a lot of like hours in the past, but now I do. So it's made me realize that I do have people around me that is my family, and I should use that.
I feel like mentally I kind of just was drained. Like I felt like life was just at a standstill. Like sometimes I wouldn't go out. There was a point where I didn't go out for maybe a month or two. And when you're stuck at home for a month, you're not exercising, you're not walking about, you're obviously putting on weight. I just felt like I wasn't really doing anything with my life.
Because my parents were recently separated, everything was put on my mom, and then you could tell, like, every time I looked at her, I felt like bad or guilty because she was dealing with so much pressure of taking care of so many people in her house, and I wanted to help out her, but like whenever I helped her out, I was missing out time on like studying, and then I didn't realize what an impact that had in the beginning, because I was like, oh, I'm just doing something good, I'll catch up later. And then it got to like May, June-ish, and I had like so much work to finish, and I felt like so hit by it. It was so much, and then I felt so worthless and stupid. And I know that sounds kind of like dramatic, but that's what I felt like. And then and that demotivated me further, because I thought I was just definitely gonna fail, so it was just a waste of like time. And then there was always the looming feeling that one of us was gonna get COVID and all of us were gonna die, because we all stay in the same house, like so many of us. It was really scary.
I could say I lost motivation because it's the school environment that kind of makes me do my work. I'm normally used to it being a place where it's like an escape from the school, and I can calm down and I can relax. And then putting those two together was just messy.
I think the teachers' expectations of how much work we could do, and especially the pressure of there may be still our GCSEs taking place, it meant that, especially if one lesson wasn't finished in that time, I had to carry it on or push it over. But I think the structure of the school changed. It was more stressful than I think going into classes. I think the fact that if I needed help, I would have to go. I'd probably have to wait like an hour or even days for a response if I were to ask my teachers.
Yeah, not seeing friends was probably the main thing that was hard, because I'm really used to seeing my friends almost every single day of my life. Being away from friends, I feel like it kind of brought me closer to my friends, because when we weren't seeing each other, we were calling each other all the time, and it brought us closer. I was really worried about it, because obviously I didn't want any of my friends and family to get ill, but also I just wanted to go back to being normal. And I always, like, sometimes at a certain point I stopped watching the news because it's just really negative, and I didn't really want to keep hearing about how many thousands of people have died every day. So then I stopped watching the news, and then maybe once in like a week I would just put it on to see that maybe if lockdown's over or school's coming back, and then when it was either it got extended or cases are going up and there's a chance that we might not even get out of lockdown to the end of the year, it would kind of put my mood down again. I would just feel like I'm back to square one and nothing's really improving.
I'm just worried that COVID is gonna like make it harder for me to go to uni next year. But because of COVID, I don't feel like I can work at my normal potential. Like I feel like I'm working below what I would have if COVID didn't happen. And I was like, oh well, you should have still worked. But like I tried to, but I just couldn't. It was like I so many things were working against me. And what does that mean for my future? Like what does it mean? Does that mean I can get into uni? Does that mean I can't? If I don't get into uni, what's next? Do you know what I mean? What's next? Do you know what I mean?
Wonderful. Thank you so much, Gina. I think such a powerful video, and I think that's reflected in the chat. We will make sure that the video is available for everyone. So thank you very much for that, Gina, for sharing that. I'm going to have to move on very quickly, if that's okay with everyone, to John Murphy, who's joining us to present on how mental health of children and young people living in our community has changed due to COVID-19. John is Chief Executive of the Oasis Community Learning, one of the UK's largest multi-academy trusts, with 52 academies clustered in 5 regions across the country. Great to have you with us and to have you join us, John. And so over to you. Thank you.
So just first of all, a big shout out for Georgina. I thought that was a wonderful video, and there's lots of different people across this afternoon who are saying, I want that video, I want that link, because it's how do we make young people feel really safe and secure with the environment. I'm not going to send any presentation. Well, I'll send you a presentation after this, but I think there's been quite a lot of cognitive overload. How much can you remember? What will be your takeaway from today? What do we understand and what we've learned? So I'm John. I've been an educationalist for the last 34 years. I'm not a specialist like many of you in terms of mental health, but I am a proud trustee of Place to Be as a mental health charity across the UK, and I'm an absolute advocate for mental health. For us in the field, it's been a really difficult time. Oasis Community Learning is really committed to the communities we serve, many of those or all of those really being disadvantaged. We work at the moment in 10 different countries across 5 different continents, and we work in education, healthcare, housing, youth services, community services, and we are now starting our work in secure schools in the same way, which we're really excited about. In the UK, in our schools, we've got 31,000 young people and 4,500 staff. 47% of those come from disadvantaged communities. So if we're talking about 47% disadvantaged pupils, obviously there are intergenerational lack of employment. And during the time of COVID, really we've seen exactly the inequity that's been, I think, presented in by many of the presentations this afternoon. It has really laid bare the inequity that our families suffer from. In our organisation, we have a few statements which are really underpinning our ethos. That we have a passion to include people, we have a desire to treat everyone equally, respecting differences. We've got a commitment to healthy and open relationships, and a deep sense of hope that things can change and be transformed. And we've all got that sense of perseverance to keep going for the long haul. That's the golden thread that binds us together. But all of us in our lives, all of you in this presentation, we're all trying to work out who are we and who are we becoming? And that's the journey that our young people are on in the same way. As an organisation, we're committed to the character and competence of our young people to make sure they're then part of transforming the communities they're in. During COVID, for all of us in society, it's been a really difficult time. There's been a loss of teaching time, a loss of learning time. We've all had to learn to lead schools in different ways. There's been big disruption to staff illness and student illness. In our organisation, we've had 6,500 students self-isolating with 10% of our workforce. We've had the challenges of setting up remote learning. I'm really concerned that in the future and now we've got children who are going to be lost to the education system. We've got increased safeguarding in vulnerable families, and we've had to do a constant amount of immediate decision making around our children. For our children, we're in a situation where there's been loss of social interaction. There's a loss of friends. There's been a loss of routine and structure. There's been a loss of learning opportunity. And I think that creates then a loss of opportunity in their lives unless we recover the situation well. For many of our families, for 20 of our families at the moment, there's been a loss of someone close through bereavement. And we've had 5 attempted suicides during this period of time. And all of that, I think, in all of us creates a heightened anxiety, low self-esteem, and with that, attention difficulties. Just to give a few facts. In terms of our food poverty, since July 2020, we've gone from 793 families experiencing food poverty to this week of 1,900. We've had heightened safety concerns with 6,023 people being on our vulnerable list. That's 20% of the children that we serve within our communities. And what's that done for all of us? It tests how much we care. It's been a test of our character, a test of our resilience, a test of really what matters. What are we going to learn from this period and moving forward? And a test of what and how much education and support, love and care really matters for our children. So for us, what has it taught us? What are we going to do? How are we going to learn from this? What we want to be able to create from this is a far more inclusive culture and ethos. We want a curriculum that really matters. We want students not to feel, how some of the students have said within the profile so far, we want them to feel that their school life can be a home life where they are loved and where they are cared for. We want to make sure that there's a real space to engage with our students and a space to engage with student and staff voice about how they work together with a sense of community. And I think the other thing is, as we've been providing food banks and food parcels to so many families, it's created stronger partnerships and friendships within our communities. What we will do as an organisation is make sure that there is access to high mental health quality or high access to high quality mental health support in every one of our schools with a commissioned service. And what we want to be able to do is make sure that our young people have that sense of feeling that they are wanted, that they are loved, and they are cared for going forward. So what I will do, as I'll stop there, is I know time is the essence, and I know there's been a number of great questions that have come in. Back to you.
Thanks very much, John. It's really important and such a kind of valuable addition to hear the perspective from schools and from teachers who are working with young people in these very, very challenging times. And thank you so much for being brief. It's really useful. I guess partly because although we're now coming to the final part, it is also, I think, the most important part, where we get to hear directly from young people in our panel discussion. And excuse me, for this, I'm gonna pass over to Beth Ingram, who's going to facilitate the discussion and the panel with young people. Beth is intentional peer support trainer, lived experience practitioner, and founder and director of Peer Youth Mental Health Services, and works with us in the Centre for Society and Mental Health, and also in the Emerging Minds Network. So it's wonderful to have you here with us, Beth, and I'll pass over to you to facilitate the final discussion. Thank you.
Awesome, thank you, Craig. Anna, Taisha, and Nia Carney, do you want to turn on your video so I can see you? We'll get going. I can't see Nia Carney, but let's get going and hopefully he can join. So yeah, like just so much to think about there, like just so many interesting talks trying to, there you are, fab. So much to like think about, but I've been introduced. How about you guys introduce yourselves and maybe say one key thing, if it's possible, from the talks that you maybe connected with a bit more or just thought was interesting or something like that. Anna, how would you feel about starting us off?
Yeah, of course. So I'm Anna. I'm in year 13, so last year of school, and fingers crossed going to university next year. I thought the video was absolutely great. I think I couldn't have put it better myself, to be honest. Lockdown started off pretty amazing. I mean, you get told that you're going home and having a mini holiday. It sounds absolutely fabulous. I think just the uncertainty that everyone has kind of highlighted of not knowing when we're going back and then things being prolonged has been really difficult. And I think something that Gemma pointed out about kind of some people finding it absolutely great and then some people having a really awful time. And something just to add that beyond kind of socioeconomic groups and different races and ethnicities, each situation is incredibly difficult. So it's incredibly difficult to kind of say, how do young people feel about COVID? Because it really depends on everything. Do you get along with your siblings, your family? Do you enjoy school? Do you not? So it's really hard to kind of have a blanket overview on things because everything is just so different. But I think that's been highlighted really well, to be honest.
Sure, thank you, Anna. Yeah, and I mean, I find often in things like this, we're expected to represent all young people everywhere, and it's like, come on, like that's not possible. We can represent ourselves, and that's it. But we can try to capture some of the stuff that's out there. Nia Carney, do you want to go next?
Yeah, sure. I really enjoyed that video from Reach Again. I liked hearing the young people's different perspectives, and yeah, just their voices, like they're all important. Doing all these groups is important. Like one of the most important things, again, the voices, like from the statistics that we're showing, they're getting their voices through and making sure everyone's heard. I also really liked nearly all the statistics, like the way everything's formatted is so easy to read and so easy to tell. And interpret what they're saying, and it shows the fruits of the research and how hard everyone's worked. So I really enjoyed that. Everyone's done amazingly, and everything that's been presented has just been amazing so far. So thank you.
Thanks, Connie. And Taishe.
Hi, I'm Taishe. I'm in year 12, so my first year of sixth form. I feel like Anna and Connie did everything. I feel like this has been very interesting, and I especially love the video. I feel like it was everyone's point of view. Like Anna said, many people enjoyed lockdown, many people didn't, and it just depends on how you grow up and your background and your house and where, like, many factors is what makes it happen. So yeah, I feel like they said everything.
Awesome. Okay, so Craig, I'm just going to ask you to cut in a few minutes before you think the time's up to help me keep track of it, if that's all right. But I thought maybe as a starting point we could have a think about, and also please do, anyone who's watching, if you submit questions in the Q&A thing, I can try and pick them up, and that will be helpful, because I find it quite difficult to keep an eye on the chat. So the first thing was, we've heard a lot about, I guess, like you guys were talking about, like first lockdown and how people felt then. Do you think that's changed? Do you think it's got better, worse, stayed the same? For me, I think in some ways it's got better. Like, I've learned better how to cope with this kind of strange way of life, but I also feel like I'm missing that social interaction way more. Like, I was outside the post office the other day and there was a random woman and I felt like hugging her, and I'm like, what's going on? I'm desperate for some kind of interaction. Like, what's been your experience?
Should I go first? I feel like it's been different. I feel like for me personally, I prefer the first lockdown. I was in year 11, so finishing school early in March, wow, this never happened before. Everything's so exciting because we've never been in lockdown. It's something new for everyone, so it's very exciting. But now that we've been in this is our third lockdown, we have to go online school now, more stress. Teachers are doing their absolute best, but loads of work, and I feel like it's a lot more stress now. And yeah, like you said, we're so used to being locked down. We've been locked away for so long. It just gets, you just want to meet people, you want to hug people. So I feel like it's got a lot worse.
How about others?
Shall I add to that?
Yeah, go for it.
I think I completely agree. The first lockdown I quite enjoyed. I think it's quite summery. Everyone was, good vibes. But now it's definitely different. I think there's more pressure on young people to know what they're doing because we've done it before. So there's an expectation that, we know how to do work online. We know how to do this. We've done this before. You just continue as you always have, which is true to an extent. But I think the problem is the uncertainty of not knowing what's going to happen and knowing that Boris can change his mind at any given moment. There's not a great deal of faith in politics at the moment, I'll say that. And I think to some extent young people have been blamed because we're, super spreaders, which I understand. There's been this thought that we are the ones going out, we're the ones spreading the virus. And actually that's not really the case, or not that I've seen. So I think sometimes it feels as though we're being blamed for stuff, but also we've got this great expectation on us. And at times it's just quite difficult. It's no longer fun. It's just, I'm fed up now, to be honest.
Yeah, amen. Yeah.
Yeah, definitely. Some really great points. And to add on further, I'd say for me, first lockdown was amazing. I mean, no, that's the wrong way to put it. First down was better, I'd say, than this one. I'd say amazing compared to this one in my case, because first one, me personally, I have three brothers, and one was in year 11 at the time, so GCSE got cancelled. Then my other two, the two older ones, and one was in the first year of uni, which also got cancelled, and one was in gap year. So all of us were at home no one was really going out, so we could, I guess, enjoy ourselves, you could say. We were playing games, having fun. Unfortunately for me, being a year 12 student, I'm the only one doing work. So sometimes I'll be doing work and I just hear them having fun, having a blast downstairs. But I feel like I realized that links into how with the second lockdown, it feels like it could go both ways. Something that some people were doing to cope in the first lockdown might not work as well in the second one because it's going kind of monotonous and kind of old, you could say. So it's harder for them to find new things to like keep themselves distracted or, keep themselves going. People had hobbies in the first one. They might not be as interesting now. But then on the other hand, like you said, Beth, yourself, some people found better ways to cope from the first lockdown, which they really had negative experience with. And now in this lockdown, they might do better in like, entertaining themselves or finding ways to, keep away from like, just getting into a bad place. So it's hard to find a kind of, it's hard to figure out what the kind of overall overarching way like people are thinking now, or people are cope. It's just, it could go either way, and some people in worst case scenario, they've had a bad experience in lockdown. It's just carried over, and it's hard for everyone. So it's just trying to figure out what the best way to work if someone's really struggling now compared to before. Look at what some people were doing previously. I mean, what some people are doing now to cope better than before, and try and see if it can be applied to some of the other people as well.
Well, thank you. And like, I guess kind of continuing on that, one of the things that was spoken about a lot was the impact on different marginalised groups. And I guess, I don't know, some of the things that I'm thinking about, like, I know for me, I'm really, really missing queer and LGBT spaces. Like, my flatmates know it, not from the flags put off everywhere or anything. But like, and we tried to have an online like party meeting thing, and it got like taken over by the like people who were shouting like a lot of racist and homophobic abuse and stuff. And I'm feeling like a lot of the detail sometimes in those things, as much as it's trying to be captured in research, is sometimes hard to capture. And I know that there's, at the same time as stuff, there was the Black Lives Matter stuff, which added so much more intensity. Like, do any of you have any experiences around that, like either for yourselves or other people you know, where it's made it like harder, easier, the same questions really? No? Oh.
Sorry, could you repeat the question quickly?
Yeah, for sure. So like, I guess thinking about the impact on like different marginalized groups. So I think we heard about ethnic minorities, we heard about lower income families, we heard about young people at risk of violence and abuse. Is there anything like you've seen or experienced that has suggested it's easier, it's worse, it's the same? Yeah, anything like that really.
One thing I'd say is, I think a positive we can bring out of it, people being online a bit more. There's obviously negatives of being online, but people being able to find communities. Sometimes, obviously, there's bad experiences of it being taken over and stuff like that, but being able to find a community with people similar to you that you might not have had when you weren't online as much, I think that's really great, because if you get the hang of like using Zoom and stuff like that, it helps with like, finding people from further away, way further away, different countries that you wouldn't have normally spoken to, but they're very similar to you. So that's definitely a positive that you found, I guess. But in a lot of cases, on being online particularly, it can have a very negative effects. Online, there's people can be taunted, stuff like that, and it's just, it's very it can go either way again, and it's I guess it's important for people to know that there are good and bad things. So even if you have had negative experience, there's, you can look into better things, communities and stuff like that you can possibly find.
I think also my mother works with young carers, and again there's this problem of some people benefit and some people don't, but I think in some circumstances it's quite nice to not kind of be in a really pressured environment. I think some people who aren't that confident and are a bit shyer and don't really want to put themselves out there have in some ways enjoyed the fact that now everyone's at home. You don't have that FOMO, that fear of missing out, because no one's having fun, no one's going out or doing anything. So you're sat at home and you're not worried about any of it. So I think now as time goes on, people actually want to get out. And I imagine there will be a bit of a possibly a roaring 20s happening again. But I think there was, especially at the beginning, that feeling of it's fine, I'm not going out because no one else is. And there's not that fear that you have at the weekend when people are having fun and you're not.
Yeah, I believe like it's difficult, especially like when George Floyd, like that was going on during lockdown. I feel like a lot of people felt like they couldn't do anything because they were stuck at home. Yeah, a lot of people did like go to like a protest still, but many people couldn't because they, for example, at risk and certain factors like that. So like that was very hard on many people because they want to support, but they couldn't. They felt like they wasn't doing anything. So I think that made a huge impact on their mental health. For example, like they want to do something but they can't because of So.
Yeah, and also another thing I want to add was another very upsetting thing that I think more recently started coming into a bit more light, but the effect on like, you know, Asians during this time. You know, there's been an increase, especially in like the US, in Asian hate crimes and stuff like that, due to them being like blamed for the virus. You know, and it's a shame. You know, it's good that it's being brought into light a bit more. But it's kind of like it shows the effect as like time goes on. People, it just seems like, you know, as they get more and more frustrated with lockdown, it seems like they're turning to more and more different reasons for it, you know, and it just causes like mayhem and stuff like that. So it's
Craig, do you think we have time for one more question?
Yeah, sure. There's still a good number of people on, Beth. So yeah, definitely.
Cool. So I guess thinking about all of that, we thought a bit about the challenges, we've thought a bit about like possible positive impacts and what as well. If there was, and we've talked a bit about how for the sake of like things have had to shut down for young people a bit for the sake of more vulnerable groups and possibly older groups as well. If there was one thing you feel like adults could learn from this period in terms of how best to support young people and how best to improve young people's lives, what would that be? I know one thing's not going to cover everything, but that's quite a big question, so I'll start off. So for me, I think it has been, it would be that you can do a lot online, but at the end of the day, and everyone gets very excited about online stuff, at the end of the day, nothing can quite replace like continual longer term relationships with people you trust in your life and adults. And I guess my plea and what I've definitely needed and tried to be for other people is that person who's there, who's around for a message, because I don't think personally any amount of social media posting or anything can replace that. But that's my view. Does anyone else have something to add?
I feel like trust is a big thing. Like young people don't trust adults. It's a thing where, for example, teachers something like trusting them to talk about stuff like mental health is very hard. Like it's really hard. So building that trust and keeping that trust is very important. Once you have that trust, don't break it. I feel like that will help young people a lot because they know that they can confide in someone and speak to someone. So that's my one thing. There's many, but that's just one.
And I feel like that echoes a lot what we heard from the Survivor Voices stuff as well. Thanks, Taito.
Yeah, and that reminded me of another thing. Gemma recently did an episode of this podcast called Our Sick Society, and she focused around teachers and their during lockdown. So I feel like it brings up the question like it'd be great with trust. I think it'd be great if teachers, like, it's clear that they have their own struggles in lockdown as well. And if there was a kind of thing schools kind of did where it made, like they kind of made it a room for discourse, I guess, or like, you know, discussion, and that where students and teachers can all kind of like talk about this kind of stuff. I guess in a more like, I guess it could be kind of like group based or something like that, but it's important. Again, trust in a relationship with your teachers is also really important, no matter how small. And through online learning, it's really hard to build that kind of, you know, relationship. You learn better if you feel like your teacher understands and respects you, and therefore you understand and respect your teacher on a different level. And if you feel like there's nothing there in school, you know, it's hard. It affects you even more. It affects you. You're in school, like the young people have been in school a lot during lockdown online. I mean, so if they had a better view on that, on going into there, instead of a negative view, and like they're not understood at all, that would really help and increase like, you know, even learning levels, but as well as like how they're feeling and, you know, mental health.
Like I imagine as well, improve it for the actual teachers and various professionals as well, to be able to be honest with like, look, this is hard, but like, let's work together to figure this out. So yeah, thank you. And Anna?
I think just in terms of how do you actually help a young person cope with things, I think at the beginning of lockdown and now there's kind of an expectation that you should be doing something. You've got all this time. You should be doing a hobby. You should be doing this. You know, don't waste your time. This is an opportunity. You know, focus on this, focus on that. And I think the best thing that anyone could have said would have been, you don't have to do anything. You're in a national lockdown. The situation's pretty bizarre. You do not have to do anything. You don't have to, you know, take up a new hobby. You don't have to learn how to bake cinnamon rolls. You don't need to do any of that. It's okay to fall behind in work. It's okay to be stressed. It's okay to have completely different thoughts about your future. It's okay to change everything, and that's absolutely fine. And you don't need to, there's no expectations, there's no pressure. You don't need to go to university straight away. You don't need to do this, do that, because it's really odd. Times are really weird, and therefore your behavior can kind of be a little bit wacky for a little bit. I mean, we're hormonal enough. You add a pandemic to it and everything kind of goes out the window, doesn't it? So I think just keeping everything relaxed is the best thing that we could do.
Yeah.
Letting young people know there are like other options, especially for like year 13 students or year 11 students. Letting them know the other options, or even year 12 students a bit early. Letting them know the other options at these kind of times is really important, so they don't get completely stuck in the mindset that, you know, if they fail said exams, it's completely over. You know, let young people know what their other options are. You know, for example, students, if exams don't go exactly as planned this year, it might seem like a bit of a detour, but take a gap year, something like that. You know, take some time for yourself and reapply, do some retakes, reapply, have another shot. It's not the end of the world, and there's more that can be done, you know. And some people have they have really high expectations, they expect of them like really high levels. So it's good that they appreciate that it's not the end of the world if it doesn't go as planned, and that can really weigh down a lot of people.
Yeah, I know the economy said everything. I felt the reassurance. Young people need reassurance. Like I feel like many people don't get that reassurance that they need. Like it's okay. It's okay if you don't get good grades. It's okay. Like there's always another way. We understand the circumstances you guys are in. Not going to 100% get A because of what's happened. So I feel like reassurance is 100% needed.
And I feel like the message of that, all of what we've all said, as well as these talks, is like just that, like we'll figure it out together. And sometimes I wish that was demonstrated at every level of society. Like we'll figure it out together for individuals, but we'll figure it out together as a society as well. And I'm going to be repeating that to myself on a daily basis. But yeah, I'll hand over to you, Craig.
Thanks very much, Beth. Sorry, I feel like I'm sort of intruding and stopping something which is such a fantastic discussion, such an invaluable discussion. And I guess the title of the conference is What Do We Know? But most importantly, what should we do? And I think hearing all of your contributions is just invaluable in guiding us in what we should do. And so I guess I do then need to round things up. So thank you very much. Thank you in particular, Nyakani, Taishai, Anna, Beth. It's been a fabulous discussion to round off the afternoon. Thank you so much, everyone, for bearing with us and for staying with us for the whole afternoon. And a huge thank you to all our speakers. Everything will be available afterwards and through the Mental Health YouTube channel and other sources which will circulate and so on. And I did have a couple of announcements and events to kind of broadcast and promote, but I'm going to do that. I'm going to let you all go off and get your tea and relax for the evening, and we can do it maybe at the start of tomorrow's session. And I hope that you will all join us tomorrow, because tomorrow what we begin to do is move not from understanding what the research is telling us and from understanding what we know from the voices of young people to thinking even more concretely, what do we do? And I guess that is, we'll pick up the discussion that we've ended on this afternoon tomorrow, 12:30. Hopefully you've all got links, but we can provide them if not. But thank you very much, everyone, and hope to see you tomorrow. Thank you. And bye, everybody. See you tomorrow.